I'm Nikki. I'm going to be taking care of you today. I'm just going to do a quick assessment on your abdomen, your muscles, your joints, and stuff like that, okay?
Okay.
All right. So first, I'm just going to say you're a well-appearing female. Your skin tone is appropriate for ethnicity. Can you tell me your name?
Caitlin, please.
And what year is it?
2022.
And where are we right now?
Parkridge.
Okay, good. So you are alert and oriented ×3. I'm going to start by examining your abdomen. So I'm going to have you lay back for me. Great. So there's no abdominal distension anywhere. I'm inspecting. I don't see anything raised. I'm just going to take a quick listen, okay? So I'm going to listen to your bowel sounds. Okay, starting each quadrant until I hear a sound. Okay, so that was upper right, upper left, lower left, and lower right. Good, you're normal active bowel sounds. I'm going to listen to your abdominal aorta. Good. I'm going to listen to your renal arteries. Your iliac arteries. Excellent. No bruits or thrills. I'm just going to palpate a little bit. So first I'm going to go nice and gentle. So it's going to be like a shallow palpation, and then I'll go a little bit deeper. Let me know if you feel any pain, okay? So this is a light palpation. Any pain when I press or when I lift back up?
No.
Okay. I'm going to go a little bit deeper now. Any pain when I press or lift back up?
No.
That's deep palpation. Good. There's no tenderness, no masses. Just going to feel for your liver. Okay. And the border. Liver border is 7 centimeters. That's normal. And I'm going to palpate your spleen. Put my hand behind your back, okay? Good. The spleen feels good. No distension and no masses. Any pain when I was pressing anywhere?
No.
Okay, great. I'm just going to have you sit up for me. I'll help you. Good. So I'm just going to do a quick neurological assessment.
Okay.
And while I'm doing it, I'm also going to be assessing like your muscles and your strength and stuff like that as well, okay? So first I'm going to start by touching your face. Do you feel anything when I touch you?
Mm-hmm.
Okay, good. So your cranial nerve number 5 is intact. So first we're going to do some visual stuff, all right?
Okay.
So I'm going to hold this and I'm going to have you read a line. So if you could cover your right eye for me. I'm going to hold this 20 feet away. All right, can you read this line for me?
DHJBS.
Excellent. And then now switch eyes. Now read the line, the smallest line you can read.
DHJBS.
Excellent. So that's 20/20 vision. So this is for cranial nerve number 2. So that was that vision. Now I'm going to assess your visual field. So I'm going to have you cover your right eye, and then I'm going to put a number in your visual fields on the side, and you tell me what number you see, okay?
2.
Okay, good.
2. 2.
Now switch eyes. And down here.
1. 1. 2.
Okay, great. And now I'm going to check your extraocular movement. So this is more cranial nerve testing. So I'm going to hold my pen light here, and I'm going to move it inward. I'm just checking for any extra movement in your eyes or any nystagmus or anything like that. So just follow my pen light, okay? Excellent. Good. No extraocular movement. That's a normal finding. So now I'm going to have you follow my pen with your eyes. I'm going to move it to your 6 visual fields, okay? So with this, I'm just looking for any shaking or gazing, okay? So follow me. Excellent. Negative for nystagmus. Good job. Okay, so that was just checking your cranial nerve number 2. And then I'm going to do cranial nerve number 1 now. So I'm going to give you something to smell. I would like you to close your eyes and tell me what you smell.
Mid.
Excellent. Good. So cranial nerve number 1 and number 2 are both intact. Now I'm going to check 3, 4, and 6. I'm going to check your perla. So I'm going to shine a light in your eyes. All right? So just look straight ahead at me, and I'm going to check for your accommodation. Good. Keep looking straight ahead. Excellent. Perla is intact, so your eyes, it was 3 and brisk. Your pupils closed and accommodated to the light well, so that's a good sign. Okay. So I tested number 5 with your facial sensation. I want you to open and close your mouth for me. Good. And then I want you to open your mouth against my hand. Excellent. So that's nice and intact there. That's number 7. So now for number 8, I'm going to do hearing. So I'm going to occlude one ear and whisper into this ear.
Okay.
And I want you to repeat back to me what I said.
Apple.
Good. Now I'm including the other side.
Banana.
Good. Your hearing is intact. So that's cranial nerve number 7. Now for cranial nerve, oh, no, that was number 8. I'm sorry. Number 9, I'm going to look in your mouth, and I'm going to check your uvula, make sure that moves. It needs to move upward, and then I'm going to gag you, okay? All right, so open up. Okay. And gag. Oh, okay. Intact. Cranial nerve number 9 is intact. Your uvula moved up, and you did have a gag reflex. And then for number 10, I'm just going to have, I can tell that number 10 is intact because you're talking to me. There's no hoarseness and you're swallowing. Okay, all right? So that's good. Number 11 is going to be your head movement, okay? So I want you to move your head side to side like this. Good. Up and down. Excellent. Shrug your shoulders. Good job. So cranial nerve number 11 is intact. And now I'm going to have you stick out your tongue. Move it from side to side. Excellent. Cranial nerve number 12. Good job. So all your cranial nerves are intact. You did a great job. Now we're going to do some range of motion and some strength in your upper extremities. Okay, so first I'm going to start, I'm going to have you lift up your shoulders. Good, against my hands. Good strength. That's 5 out of 5. Okay, I'm going to have you push down on my arms. Excellent. Push up. 5 out of 5. And with your hands, push down. And flip over. And push up. Good, good strength. Any pain in your scapulas? And your clavicle? Okay, good. I'm going to feel your joints. I'm just feeling for any grinding or any crepitus. Good. And your elbow. Good. And your wrist. Excellent. And the other side. No grinding, all normal grindings. A little bit of popping, but that just happens sometimes. And your wrist. Excellent. Good. I'm going to check some reflexes now.
Okay.
So I'm going to check. First, I'm going to check your bicep. So I'm just going to put my hand here. I'm going to have you relax this here. And I'm going to just hit my hammer here. I'm looking for this tendon to contract and your arm to move up. Okay? Good. Excellent. +3. And now I'm going to do your tricep on this side. Just relax this arm. Excellent. I saw that. So that's 3+. And this one is your radial brachial. Good. Excellent. +3. And now on this side, we're going to do the same thing, all right? Just relax this. All right. Brachial. That's your bicep. Just relax this arm. Just let it hang on me. I will support your arm. Just like this. Okay, just let it relax. Good. Give yourself a movement. Good. And now right here as well. Good. All right. Nice job. So when I was touching you, did anything feel different on each side? Everything feels normal. Your skin tone is good temperature. Nothing feels cold. I'm going to take a look at your hands. I'm going to feel your hands now. Excellent. There's no clubbing, no signs of like osteoporosis or anything like that. I'm going to feel your pulses. Good radial pulses, +2, and brachial. Good, +2. Good. Your hands look good. Good color in your nail beds. Good blood. That means good blood flow. Okay, that's all within normal limits. Okay. Next thing I'm going to do is I'm going to have you lay back, and I'm going to do your hips. Okay, so lay back. I'm just going to feel your hips. Any pain when I press down? No pain in your pelvis? Okay. I'm going to have you extend your leg. You can do one at a time if it's difficult. I'm going to have you flex your leg in. No, you're going to, sorry. Abduct and adduct your hip. I just want to see good range of motion. Good. All right, other leg. Good. Any pain or anything like that when you do that? Okay. I'm going to have you do the same thing with your knees. Bend straighten it out and bend it in. Good. And straighten this leg out and bend it in. Excellent. And then with your feet too. So I'll hold your legs up, and then I'm going to have you plant or flex and extend. Good range of motion. Excellent. Okay. So that's good on that end. I'm going to just check your reflexes on your knees. You can sit up for this portion as well. Just let your leg dangle. I'm going to tap your knee and check for reflexes. Good. Another side. Good. Plus 3 reflexes, and now I'm going to do your foot. Just let it dangle. Good. And I'm just looking for some flexion here. Okay, and then I'm going to have you lift your foot up, and I'm going to do what's called a Babinski reflex, all right? And I'm just checking to make sure that your toes fan in, okay? So I'm going to just take your shoe off, and I'm going to swipe my hammer up the side of your foot. Okay, good. That's good on this side. So it's a negative Babinski. Good. Good. Your toes curled in. Excellent. Keep looking. Let's see. Okay. So now I'm going to test the strength in your legs, okay? Mm-hmm. Well, let's do the range of motion in your upper body first. So I'm going to have you bend your elbows and put them straight. Okay. Can you lift this arm up to this side? Excellent. And the other arm. Good range of motion. And your wrists up and down. Good strength. Push against my arms, please. Good strength and good range of motion in the upper extremities. Okay, now for your legs. I want you to push against my hands. Good. Now pull against my hands. Excellent. Lift your legs up against my hands. All right, and down. Good. And I want you to push like you're pushing the gas pedal and pull back. All right, good. So you have good strength and good range of motion in your upper and lower extremities. So that's all good things. Now I'm going to have you stand up, and I'm going to have you walk towards me. Let me. Okay, good, steady gait, and I'm going to have you walk back. Good. You are walking heel-toe, which is good. That's normal. And I want you to walk on your heels for me now. Can you walk on your heels? Good. Good balance. Okay, you can go back. And can you walk on your tippy toes? Good. You should hold your arms out in front of you and close your eyes. I'm just checking for any drift or anything like that. No? Okay, good. That's good. Okay. You can have a seat now. So we checked most of the range of motion. I'm going to check your spine. So your spine looks good. Nice, good posture. I'm going to feel for any pain, anything like that as I go up your spine. Okay, no step-offs, no injuries. All right. Push back against me. Okay, now range of motion for your back. I want you to lean back a little bit. Good. And lean forward for me. And then to your one side and to your other side. Excellent. Good range of motion. All right. So all your reflexes are great. I checked all your reflexes. I checked your range of motion. Everything seems to be in good working order. Any questions for me?
No.
Okay, great.